Hi, my name is Hillary Mower, and I am an MSW candidate at the University of Washington in Tacoma.
Hi, everyone. My name is Donna Marklund, and I am also an MSW candidate at the University of Washington in Tacoma. And Hillary and I have created a program called the Garage for our capstone that is looking at supporting youth struggling with substance use, either their own or their families or a friend's, somebody else's. And the inspiration for this program is that a lot of youth are struggling with substance use today. My background is working at a chemical dependency treatment center for over a decade, and I've seen a lot of youth that are struggling with substance use. So the more we can support our youth, the better, I think. And I'm also a child of an alcoholic, and I'm just inspired to create a program to support my community in this area.
And for me, I've been working in child welfare for about 6 years. I've worked at a rehab facility for teenage youth. I've seen how youth are impacted by substance use, whether it's their own personal use or whether it's their family and parents' youth or their friends. And one thing I've seen is that there isn't a whole ton of interventions in our society. And I'm hopeful that this could be a program that would help to meet their needs and hopefully reduce an reduction of substance use amongst our society. Part of the research we did to help support the benefit and need of this intervention determined that substance use has a lot of problems. It can result in a lot of issues. The misuse of drugs is associated with significant problems that include victimization, transmission of HIV, homelessness, mental distress, and incarceration. It can also include and result in poor health, increased suicide attempts, deficits in psychosocial functioning, and a low quality of life. Substance use can also have a really negative impact on families, and that results in emotional burden, economic burdens, relationship distress, family instability, and could potentially also result in significant negatives on a developing fetus or children. When we were researching and working on developing this intervention, we did reach out to stakeholders in our society. And some of those stakeholders that we talked to included program directors of substance use treatment facilities, program directors of family support agencies, teachers of substance use interventions, teachers of adolescence, and parents, school boards that have that information that they're constantly seeing. And what these stakeholders stated to us was that adolescents are struggling with substance use in our society. Substance use can begin as early as 12 for these kids, and it continues into the adult life, and it just creates such a problem. What our stakeholders also said is that our society lacks the treatment interventions to help these individuals that are struggling with substance use. And so amongst that, and the lack of community collaboration amongst our resources, the lack of wraparound services, we decided that this would be a very beneficial program to be developed. And the Garage was created to help address the needs of our youth. And one of the needs of the Garage is that youth struggling with substance use need knowledge surrounding community resources in substance use and prevention to decrease the likelihood youth will continue to engage in substance use. The goal of the Garage is that youth will be empowered to make positive decisions around substance use. To help us accomplish the need and the goal in our society related to youth struggling with substance use, our intervention was created, and Donna will speak more into that.
Right. So as you've heard, substance use continues to be on the rise in our communities, and to reduce substance use in our communities with our youth, we created this program called the Garage. This youth program will provide youth with a sober environment, prevention tools, coping skills, and a variety of resources to support them to meet their needs individually. The primary goal of the Garage is to provide support to these youth, again, like we mentioned, whether it's their own or their families or friends' substance use. We are going to give them a chance to have case management, and we will connect them with other community resources via referrals. And we're really hoping to be available for the youth by being open 7 days a week, promoting the accessibility. And also we just really want to promote a supportive and comforting environment. We are going to provide fresh food daily, snacks, and also there are going to be opportunities to do homework. There'll be internet, there'll be showers, etc., etc. And again, the hope is for the garage to provide a safe place where supportive staff and an environment where youth can feel both empowered and also comfortable to ask staff for help to live their best lives. The theory that supports this capstone, we're using the ecological theory, and which to understand the impact of youth environments and what their environment can have on them. And also we're also using the self-determination theory. And here is basically a theory that supports our garage, or the garage's utilization of motivational interviewing, just so as that can promote youth to find their own motivation to make positive behavior changes by utilizing adequate listening skills to express both empathy and support self-efficiency. And so I think that's about it for our theory, and also to help to demonstrate the effectiveness of our program. We have our objectives that I wanted to share with you. So the objective 1 would be for youth to have improved resilience and emotional well-being, and to measure that would be to they consistently follow their case plans, and also that they feel supported by others. Another objective would be youth knowledge of treatment of substance use, and for example, via knowledge of prevention tools, and also that they understand the treatment of the condition. And on top of that, we're also going to do, when youth enters the program, we'll have a survey, and every 3 months we will have that same survey. And also at the end of the program, there will be a survey as well. And next, we want to talk about our hope for this whole project in our capstone called the Garage is to really just support our communities, and especially our youth, because we all have been youth at one point. So we know it can be a challenging time anyway. So if you add substance use to it, whether it's your own or somebody else's, it can be a really big challenge so to have this safe place where you can come for support, whether it's case management or doing activities, or it's the educational group, or it's just a support group. We're just hoping that this is really going to benefit our youth in our communities, and we're really excited about it. And other than that, I just wanted to thank my mentor for supporting me throughout this process, and our stakeholders. They were amazing and gave such great information to us, and also to my family for supporting me. And thank you, Hillary, as well.
Yeah, and I wanted to say thanks especially to our stakeholders as well. I reiterate that we couldn't have done that with the additional insight from our community to get a good understanding of this problem in our society, and to figure out, what might be beneficial to these youth. On top of that, I'd really like to thank our instructors that we've worked with throughout the MSW program to help us gain the knowledge to create a program that can help address this social problem. Alongside that, I just really appreciate my cohort and everybody else for their support throughout this. And it's been difficult with COVID, and hopefully things continue to improve, and hopefully programs like this can exist and help the members of our society. So thank you guys.
Thank you.